Can I thank everyone who sent me kind wishes. Thank you all very much. It was very thoughtful of you. Ceann Comhairle, having been sick and experienced the virus at first hand, it certainly sharpens your understanding of everything surrounding this public health emergency, but most particularly, I think, the big gap that there has been between, on the one hand, the very ambitious announcements that have been made and in many cases, in fact, re-announced, and what was actually happening on the ground. Taoiseach, I waited 16 days for a test result, and this wasn't unique, far from it. In fact, others waited longer times, and in some cases, these were frontline health workers. I think we can all accept that that is unacceptable, in fact scandalous, and that it needs to be fixed. You say that it is. I hope that we see evidence of that fact. But just this week I heard a woman on RTE radio tell her story, and she's still waiting for her deceased husband's test results. That man was tested on March the 27th. And this woman can't get a death certificate, she said, because of this delay. And you see, the announcement and re-announcement of testing capacity just never became a reality on the ground. And so now we have new targets. And you said this morning, Taoiseach, we have a target of 100,000 tests a week. That has to be real. That has to happen. It has to be seen to be happening, it has to be more than an exercise in collecting swabs and samples. The actual tests have to happen. We need efficient reporting and then, crucially, contact tracing, because the contact tracing is reliant on the result of the test being reported back. Taoiseach, you say that you're concerned about complacency. Well, so am I. Although it has to be recorded and said, the communities and families, the Irish people, have rallied magnificently to very difficult asks of them in very, very difficult circumstances. But nonetheless, I share your concern around complacency. I'm concerned also about mixed messages and kite flying from your government, because, of course, all of us want to see people back at work, businesses back functioning, schools reopened, colleges and so on. We all believe in that. But can I put it to you that it's not plausible, it's not advisable, it's in fact not safe to unwind public health restrictions until we have a wide, comprehensive and efficient testing system and the follow-up contact tracing too. Because the mantra has been test, isolate, trace. We know that that is how we keep people safe. We know that this is how we manage to stay ahead of this virus, not just in the here and now, but in the coming weeks, in the coming months, indeed, until that time that we have effective antivirals and ultimately a vaccine. But until that time, we need to be clear. Precautions and measures will have to be taken to keep people safe and to avoid deaths. I record again our sympathies for all of those who have buried their loved ones in such heartbreaking and incredibly difficult circumstances. The good news, as you have recorded, Taoiseach, correctly, is that our health service has not been overwhelmed. The good news is that we have collectively managed to flatten the curve. But the cautionary note has to be this, that moving too quickly could allow this virus the scope to spread, to surge at a later date, perhaps even to mutate, to become even more virulent. And we cannot, under any circumstances, do things that allow that to happen. And I think there needs to be absolute clarity from government to the people, to all of us on that point. Taoiseach, caithfí mé ceist de cur faoin géir céim in our tithe altranais. Mar tá is agat tá níos mó na leath na bás sa stáit ó COVID-19 tar éis Tharla ann. Tá cuileadh ceann de na básanna seo fiúntach. Taoiseach, I have to ask you about the heartbreaking crisis in our nursing homes. As you know, more than half of the deaths in the state resulting from COVID-19 have occurred in these settings. And every one of these deaths is meaningful. It's a life lost, a story ended in the most awful of circumstances, leaving behind families and friends who are absolutely devastated. The government's approach to nursing homes has been characterised by a lack of urgency and by mistakes being made, and I think there needs to be clarity on that point. The lack of urgency gave rise to a number of very important issues that haven't yet been answered satisfactorily. We still don't have a clear answer as to why Simon Harris refused to meet with Nursing Homes Ireland in the early stages of this crisis, despite their repeated requests. I want to know why that was. The Minister only agreed to meet in late March when Nursing Homes Ireland went public with their frustration. So can we have clarity from you on that point today? Likewise, there has to be an adequate and a clear public explanation as to why the Department of Health criticised the decision of nursing homes to introduce a visitors ban on March 4th. They said at the time that Nursing Homes Ireland was moving too quickly. I think it's clear now that that was the wrong call. I think the nursing homes were ahead of the system. Can you explain why this happened when the World Health Organization was urging, almost begging, European governments to move and to move faster? I think we also need clarity on the delays surrounding the On Call for Ireland initiative, a very successful initiative that health professionals have responded to in huge numbers. However, by this time last week, only 1,300 applicants were processed through the system from a pool of 73,000 people. At a time when nursing homes in particular are literally crying out for staff. They can't fill rosters. Given the magnitude of what's unfolding in nursing homes throughout the country and other residential and congregated settings, these questions need very clear and precise answers. Taoiseach, I want to give you some ideas as to what I think you need to do in respect of nursing homes, and I'd like your response to them. I suggest that you ensure that each acute hospital be assigned the job of monitoring the nursing homes and congregated settings in their catchment areas, that they be fully resourced to allow for fast, rapid local responses. I propose that you shift the focus of the On Call for Ireland programme to nursing homes and fast-track the process to ensure that they have the necessary staff. I propose that you direct the HSE to look at using the spare capacity and very expensive capacity in private hospitals to alleviate the pressure in our nursing homes where necessary. And we should also make use of the community assessment hubs for this purpose too. And also, Taoiseach, that you accelerate the supply of personal protective equipment to nursing homes and other residential settings from today. If we do these things, and if we assess them and measure them, if we act now, then we stand a chance of turning the tide of this emergency in our nursing homes. We stand a better chance of saving lives. And I think this is the very least that we owe to our elderly citizens and to their families, because as you accept yourself, Taoiseach, we have a particular duty to protect them and vulnerable groups in our society.